hold connect. Okay, there's start broadcast. All right. Okay.
The broadcast is now starting. All attendees are in listen-only mode.
Good morning, and thank you for joining us today. I'm Lisa Pachuti, an oncology social worker here in the Carol G. Simon Cancer Center at Morristown Medical Center. I'd like to welcome you to our webinar on survivorship, presented by two of our nurse navigators, Mary Mason and Sandra Wrigley. Let me introduce Mary and Sandra to you. Mary is the GI nurse navigator in the Carol G. Simon Cancer Center at Morristown Medical Center. She has practiced in the field of oncology nursing for over 30 years. Her experience includes direct patient care, chemotherapy administration, managing an oncology unit, coordinating an oncology program, clinical research, and home care and hospice. She is an active member of the Oncology Nursing Society and the Association of Oncology Nurse Navigators. Sandy is the breast navigator in the Carol G. Simon Cancer Center at Overlook Medical Center. She has practiced as an RN for over 30 years. She has been the breast nurse navigator at Overlook since 2010. She is a registered nurse and a certified breast navigator in breast imaging and cancer care. She is also a certified mastectomy fitter. She worked at Mount Sinai Medical Center in New York City before coming to Overlook, and she is originally from South Africa. Today's presentation will be in listen-only mode, but you can ask questions via the question box on the webinar toolbar at any time. We'll gather the questions throughout the program, and we'll answer them at the end of the webinar. We'll begin this presentation with Mary.
Hi, my name is Mary Mason. I'm the GI Nurse Navigator at Morristown Medical Center, and I would like to welcome you and thank you for joining this webinar presentation, which has been prepared by the Oncology Nurse Navigators at Overlook Medical Center and Morristown Medical Center. First, a little background as to why we put this webinar together. One of the latest movements in personalized oncology care focuses on survivorship. And why is that? It's because as of January 2012, an estimated 13.7 million cancer survivors were living in the United States. The 5-year relative survival rate for all cancers has improved from 49% for cancers diagnosed approximately 35 years ago to 67% for cancers diagnosed approximately 10 years ago. That's nearly a 20% increase. The good news is that the cancer survivorship population is growing. However, the cancer survivor population is growing concurrently with a projected shortage of oncology physicians. And a source from a 2007 article from the Journal of Oncology Practice projects that the United States is expected to face a near 48% increase in demand for oncology services by 2020. So the rapidly increasing survivor population and the predicted inevitable shortages of both oncology specialists and primary care physicians present a potential barrier to ensuring optimal follow-up care for cancer survivors. Oncology nurse navigators can help. The truth is, high-quality survivorship care requires teamwork, and the team players being the patient, the oncology physician, the oncology nurses, including nurse practitioners and nurse navigators, primary care physicians, support services such as social workers, dietitians, and genetic counselors, to name a few. And nurse navigators can help patients connect with these support services and provide tools to effectively communicate to your healthcare provider. So the purpose of this webinar is to provide you with information related to cancer survivorship, to define and discuss the importance of both a treatment summary and a survivorship care plan, and to encourage cancer survivors to take an active role in obtaining the necessary information, understanding their treatment and their follow-up surveillance recommendations, and communicating appropriate information about their medical care to their healthcare providers. So what is survivorship? Survivorship is the process of living with, through, and beyond cancer. Survivorship begins at the time of a cancer diagnosis, and it includes 4 components. The first is prevention and early detection, and this relates to the prevention and early detection of complications of the disease and the treatment, prevention and early detection of other cancers or health issues, and prevention and early detection of a cancer recurrence. Survivorship includes surveillance, and that's the process of medical monitoring throughout the course of treatment or upon completion of treatment for cancer. This includes things such as lab work, imaging, colonoscopies, to name a few. Survivorship includes interventions for the consequences of cancer and cancer treatment. And these interventions include things as side effect management, management and interventions of the physical complications of some cancers, and interventions for psychological consequences of a cancer diagnosis and treatment, such as anxiety, fear, relationship issues, sexuality. Survivorship also includes coordination of care, which is one of the prime roles of the nurse navigator. And this is the facilitating of knowledge of, and access to compliance with recommendations for follow-up care. So what is an oncology nurse navigator, and how can they help? An oncology nurse navigator is an RN with a knowledge base in the field of oncology who acts as an advocate to remove barriers to care, provide education and support, and assist in providing timely access to care. So Nurse Navigator provides individualized assistance to patients and families and caregivers who have been diagnosed with cancer. In an optimal situation, this occurs at the time of the initial diagnosis. However, a Nurse Navigator can be referred to a patient at any point in time to act as an advocate and provide guidance. Next, a Nurse Navigator reviews the diagnosis and treatment options presented by the physicians. A cancer diagnosis is overwhelming, to say the least. There's information overload. And since most people retain only a portion of what is explained to them in a stressful situation, the Nurse Navigator can help make sense of confusing and overwhelming information. Next, a Nurse Navigator can coordinate care and assist with the transition from diagnosis to treatment. The Nurse Navigator can act as a point of contact, especially throughout a complicated staging workup and consultations with numerous physicians, and really helps prevent things from falling through the cracks. The Nurse Navigator can refer to appropriate support services such as social workers, dietitians, financial counselors, transportation, and physical therapy. The Nurse Navigator provides education, guidance, and support throughout the course of treatment and through survivorship. Now, individual needs may vary from patient to patient, but the Nurse Navigator can be contacted and available for patients throughout their continuum of care. Again, a point of contact for the patient. The Nurse Navigator provides the patients with information and guidance about post-treatment issues, and patients and their families are given practical information to help cope with the transition from treatment to recovery. For example, practical information can in part include information regarding standard of care guidelines for breast cancer or colorectal cancer follow-up surveillance. It can include contact information and survivorship resources. It can include tools for keeping tracks of appointments and recommendations. So two such tools are the treatment summary and the survivorship care plan. The treatment summary is important for all patients who have received or are receiving treatment for cancer, whether that treatment is surgery, chemotherapy, radiation therapy, or a combination of these treatment modalities, which is most often the case. It includes a written summary of the type and stage of the cancer diagnosis. It includes an overall summary of one's cancer treatment, which includes surgeries, radiation, treatments, and chemotherapy received. And it includes contact information of healthcare providers. Again, it should be initiated at the start of treatment and can be updated accordingly over time. A survivorship care plan is a care plan for recommended post-treatment testing and physician follow-up. It includes information on resources for rehabilitative and supportive care. It includes cancer screening recommendations, and it includes recommendations regarding healthy lifestyle and wellness. So the survivorship care plan will vary depending on the type of cancer, the stage of cancer, and the treatment received. And it is typically provided by the oncology physician upon completion of one's treatment for cancer. So why are treatment summaries and survivorship care plans important? They provide patients with the details of their cancer diagnosis and treatment regimen. So this prevents the need to recall specific dates and names of treatments, and it also facilitates one's understanding of the treatments they've received. Treatment summaries and survivorship care plan encourages patients to take an active role in communicating information related to their cancer diagnosis and treatment to their healthcare provider. With knowledge is power, and the treatment summary information and template provides patients not only with factual information regarding their care, but it also guides patients in understanding what it is they need to know about their diagnosis and treatment. In this way, they can communicate more effectively to all of their healthcare providers, those who have or have not been involved in their cancer care. And when a patient has this knowledge and information, it facilitates communication and improves coordination of care between the oncologist, primary care physicians, and other healthcare providers. The survivorship care plan outlines post-treatment follow-up recommendations, such as when a follow-up CAT scan or mammogram or colonoscopy should occur. And it provides information regarding maintaining a healthy lifestyle and promoting wellness. So a little bit about follow-up care after cancer treatment. The experience of moving from a period of active treatment into post-treatment survivorship can greatly vary from person to person. There may be challenges that are physical, psychological, financial in nature. There may be unexpected emotions, and there may be confusion as to what comes next in terms of follow-up care. So it is our hope that providing information related to follow-up care and thus encouraging patients to take an active role in their own advocacy will help reduce the feelings of anxiety or helplessness and will promote optimal health and high-quality survivorship care. So again, survivorship care is the prevention and early detection of cancer recurrence and other cancers. It is identification and management of physical and psychosocial needs of the survivor. Follow-up care involves routine medical exams, which include a review of the patient's medical history, physical exam, diagnostic tests. And follow-up care is based on the individual patient's cancer diagnosis, age, and overall health. So as I pass the baton here over to Sandy, we're going to let you know about the following tools that are available at the Carol G. Simon Cancer Center. And again, these tools are to facilitate your understanding of what information you need to capture. They'll help organize your personal health information in relation to a cancer diagnosis, provide a means by which one can communicate this important information to all healthcare providers as it captures multiple treatment modalities in a concise chronological order and outlines a specific plan for follow-up after treatment. Sandy?
Thank you, Mary.
Good morning, everyone. My name is Sandy Wrigley, and I'm the breast cancer nurse navigator at Overlook Medical Center. At the Carol G. Simon Cancer Center, our patients are encouraged to take an active role in communicating information about their medical care to their various healthcare providers. Tools for documentation of this multimodality treatment summary and cancer surveillance plan are available to all our cancer patients, and assistance can be provided to patients in terms of how to complete these forms, how to gather all the information. Understanding that cancer care often requires multiple different types of treatment, for example, surgery, chemotherapy, radiation therapy, over an extended period of time. Patients should have an ongoing record or a summary of the treatment they have received and the plan that their doctors would like them to use post-treatment for surveillance. The following tools are available for patients at the Carol G. Simon Cancer Center. We have cancer treatment summaries specifically for breast cancer patients, and for patients treated for, we call it GI cancers, this is gastrointestinal cancers, as well as other cancers. Then we have cancer survivorship care plans specific to breast cancer, GI cancer, and other cancers. We also provide patients with a follow-up surveillance log, and we hand out the American Society of Clinical Oncology Cancer Survivorship Patient Information Booklet. This booklet provides advice on improving the quality of life of cancer patients. Educational materials for nutrition, cancer screenings, and healthy lifestyle practices are available. We also have a medication reconciliation form to help patients keep track of what medications they are on, the dosage of medication, and this can be shared with their various healthcare providers, including primary care physicians, so that when they go to a physician's office for a follow-up visit and they ask what medications you're on, they can simply hand them this form. Now I'm showing you on the screen the breast treatment summary. I know the font is very small and maybe difficult to read, but if you would like to obtain a copy of any of these documents, this will be available through Lisa at the end of the webinar. She will explain how to get copies of these forms. So a treatment summary form is a tool that captures the date of diagnosis and the specific type of cancer, the stage of the cancer, and the specific treatments the patient received. If we look at this breast cancer treatment summary, it lists the names of the physicians treating the patient. So the patient has a team of physicians taking care of them, their contact numbers, and then background information specific to their cancer diagnosis if genetic testing was performed. This is not required for all patients, but if it was performed, it will give the results of those tests. Then diagnostic tests are listed, and this can be helpful for other physicians treating the patient. They'll know which diagnostic tests were performed on the patient. Dates of surgery and the pathology results of the specific pathology tests that were done. If a patient receives chemotherapy, we keep a log of the treatment received and the dates and the side effects patients may have experienced as a result of that treatment. Then radiation, if a patient, not all patients have radiation, but if they did have radiation therapy, the dates of when the treatment was given. And some breast cancer patients will be on a hormonal therapy. We also call this endocrine therapy. These therapies can be given over an extended period of time, so it's important to know the date this treatment was started so that the patients can adhere to their treatment schedule. We can also list post-treatment comments. For example, if a patient had lymphedema following breast cancer treatment, this can be recorded here when they saw the lymphedema therapist, or if they went to see a physical therapist, if they had difficulties with regaining their full range of movement post-treatment. Then we have a GI treatment summary up on the screen. The GI treatment summary is very similar to the breast summary, again listing the date of diagnosis, the staging of the patient's cancer, the specific tests that were performed, and then the dates of treatment, surgery, radiation, chemotherapy, and a nice log of the treating physician's contact information. This is what we call a generic treatment summary. So basically, this can be used by any cancer patient. It's a template that will be customized for the individual patient, and following the same types of treatment, dates of treatment. So as you can see, these summaries are completed on an ongoing basis. As one treatment modality is completed, surgery is completed, that information will be filled in, so the surgeon can help the patient complete this, and then the radiation oncologist can do their section. So patients and their treating physician will complete this together. Then we have survivorship care plans. Once patients have completed active treatment, they would be given a survivorship care plan. These plans include surveillance recommendations. For example, breast cancer patients will be advised when to return for a post-treatment mammogram if it is required, and their physical examination. Patients are reminded to continue monthly breast self-examination. It's listed here. And there's also a list. I know, once again, the font is very small. Symptoms of recurrence, making patients aware of any symptom causes them concern, if it persists, to then contact their medical oncologist. And we also want patients to remember they've been treated for breast cancer, but they need to resume their annual wellness physical checkup with their primary care physician. So right down here at the bottom, the reminder is to discuss with your primary care physician if they need a bone density test, pap smear, that would be with their gynecologist, colonoscopy. They still need to do annual skin checks for skin cancer, and routine blood tests to check cholesterol levels, vitamin D levels. So we want patients to resume their wellness checks and to communicate with their primary care physician what tests they've had done, what tests they still need to have performed. The patients that have been treated for breast cancer, if they are taking tamoxifen, they are at a slight increased risk for contracting endometrial cancer. This is cancer of the lining of the uterus. So it is extremely important that they resume their annual checkup with their gynecologist and make the gynecologist aware of the fact that they are now taking a hormone treatment, tamoxifen. For colorectal cancer patients, this is the survivorship care plan, and there are specific tests for this patient population. For example, the CEA blood test, and their treating physician will tell them how often they want them to have that test performed. They are also going to be having CT scans, and the doctor will discuss with the individual patient when they want to schedule these CT scans and colonoscopies. Then there is a surveillance log. This helps the patient keep track of all those appointment dates, and it just makes it easier for the patient to ensure that they have these tests in a timely manner. The survivors are encouraged to maintain a therapeutic relationship with their primary care physician throughout their lifetime and to communicate with them all the details of treatments they've received from other doctors is valuable for the patients as well as their healthcare providers. At Atlantic Health, we follow the standard of care guidelines. However, specific surveillance is based upon the individual patient's diagnosis, stage of cancer, the patient's age, and their overall health. The follow-up surveillance log helps patients have a concise list of their physician and when their next appointment date is due. It can be used as a guide for monitoring the diagnostic tests. And in the bottom section, you'll see that you can list the tests that are required in the future. Patients can keep their log together with their treatment summary and their survivorship care plan in a binder that they take with them to each appointment with their different physicians. This just helps patients keep everything in one place, and at each time they go to a doctor's visit, they take that binder with them, and then all the information is there and it's updated at each visit. To define survivorship, some people do not feel comfortable calling themselves survivors, while others embrace this term. Regardless of the words that you choose, it is important to define your own individual path to navigate. We want our patients to not only survive, but to thrive after cancer treatment. We have a lot of resources at Atlantic Health. On this slide are different links to websites that could be very helpful for cancer survivors. The first one is our Atlantic Health website. Then the American Cancer Society has the Cancer Survivors Network. The National Coalition for Cancer Survivorship provides a cancer survival toolbox. And Journey Forward is a good program for patients who have recently completed active treatment. Patients are welcome to contact their navigators for assistance, and we have listed the names and contact phone numbers for the navigators at Morristown Medical Center. Mary Mason, who spoke earlier, is the GI navigator. Jeannie Silver is the breast nurse navigator at Morristown, and at Overlook, the GI navigator is Donna Seidman, and myself, the breast nurse navigator. I'll now hand you back to Lisa. Thank you.
All right, thank you, Mary and Sandy. That was really informative, and we have some questions that have come through. So just give me one moment. All right, I don't know who would like to answer this first one. Is what is the best format for a treatment summary? A letter, something electronic for a patient traveling to carry at all times?
Well, I would suggest using our template, which again can be started at the beginning of treatment and filled in along the way so that it's completed by the end of treatment. Our forms are simple and 2 pages, you know, a front and a back for a treatment summary. It's not complicated and captures the dates. So, and the treatment survivorship care plan as well is 2 pages. So those are easy to, you know, copy, stick in a pocketbook or a folder, and that's what I would suggest. Right now we don't have an electronic fill-in version of these forms. That may be in the future, but right now they're hard copy paper forms.
All right. Our next question is, excuse me, when treatment ended, I was almost paralyzed with the fear of recurrence. Do you have any support groups for patients who have completed cancer treatment?
This is a common emotion experienced by patients. While they're in active treatment, they feel safe because they have regular appointments with their oncologist, they're meeting with health and this fear of recurrence is a common emotion that patients experience. So we do have post-treatment support groups where you can get peer support from other patients who've completed treatment who are perhaps experiencing the same emotions you are. We also have our oncology social workers who counsel patients and encourage patients, if you do feel a fear of recurrence, to come in and meet with them, and they can discuss with you ways to cope with this fear and certainly refer you to our programs that can help manage the emotional impact of once treatment ends. And also it's a time when patients, they were so busy while in treatment, getting to all those appointments. Now there's time to reflect on what you've just experienced, what you've been through. So to get counseling from one of our professional social workers is a really good idea.
Thank you. Okay. The next question is, who prepares the treatment summary and survivor plan, the doctor or somebody else?
The treatment summary right now is initiated usually by one of the nurses. Since the nurse navigators at both hospitals have been instrumental in building these forms and providing these tools, typically we are the ones to present this to the patient and assist them in filling it out. However, the doctor can fill it out. Certainly he has that information. The nurse practitioners in the physician's office can also fill it out. And if you have a nurse navigator, you could certainly contact your nurse navigator for assistance. If you don't, these forms are simple tools, and the information is pretty self-explanatory, so we can provide you with a blank tool that you present to your physician or nurse practitioner to fill out.
Great. The next question, and this will be our last question, is I dread going for my follow-up mammogram every 6 months. What advice would you give?
For patients returning for their mammogram, that anticipatory anxiety is something that most patients struggle with. So we recommend that you take a friend or a family member with you on the day of your appointment. We also recommend that you schedule that appointment early in the week, not on a Friday, so that you're not worrying all weekend about when that result comes out. So schedule that follow-up mammogram on a Monday or a Tuesday, and then you will get your results sooner. We also recommend that when the patient goes to the mammography center, that you tell the staff there that you are feeling very anxious, so that they can give you additional support and help you deal with that anxiety. And then to plan something nice to do afterwards to reward yourself. So if you went for the mammogram in the morning, then go out for a nice lunch, and don't make it a day you dread. You have the mammogram, but then reward yourself with something nice afterwards.
Thank you, Mary and Sandy. That's the end of our webinar today. If you'd like to get a copy of one of the forms, call me at 973-971-7971, and I can either email them out to you or put them in the mail to you. So thanks so much.